What if I told you that something you've done for most of your life, maybe even every day, could quietly be damaging your penis right now? I'm Dr. James Ellison, a board-certified urologist and men's health specialist with over 30 years of experience helping real men with real concerns. And today, we need to have an honest talk about masturbation, especially after age 60. You've heard it your whole life. Masturbation is healthy. It's harmless. It's totally natural. But is that still true as you get older? Or has your body and your penis changed in ways that make this habit riskier than you think? In this video, I'm going to break down the real science behind what daily masturbation does to your body as you age, including its effects on penile tissue, erection strength, sensitivity, and even your prostate health. I'll show you what's helpful, what's harmful, and what you can do today to protect your sexual health, naturally and safely. And near the end, I'll reveal one subtle but critical warning sign, a small change in your penis that could signal long-term damage already underway. Most men miss it, but you won't after this. Before we start, if you appreciate honest, no-nonsense health advice tailored for men your age, hit subscribe and turn on the bell so you never miss a vital update. And if this video speaks to you, type 1 in the comments. If not, type 0. I read every response, and your feedback helps me serve you better. If not, type 0 and let me know how I can better support your journey. Let's begin with the foundation of all sexual function: blood flow. You see, an erection is not just about arousal, it's about circulation, and as we age, the highways that carry blood to your penis, your arteries and veins don't work quite like they used to. This is where things start to change, and why daily masturbation might be doing more harm than you realize. 1. Vascular health. Blood flow is everything. When I sit across from a patient in his late 60s or 70s, and he tells me that his erections aren't what they used to be, the first thing I look at isn't testosterone, it's blood flow. Why? Because at the end of the day, an erection is a vascular event. It's all about circulation. If the blood isn't getting there or staying there, everything else falls apart as we age. The arteries that supply the penis start to narrow. That's natural. Years of cholesterol, build up, less physical activity, and changes in the elasticity of blood vessels all contribute. But when you introduce daily masturbation into that equation, especially with pressure or frequency that your younger self could handle, you may be pushing those delicate vessels past their limit. I've seen men who unknowingly cause micro-injuries to their penile tissue through daily aggressive stimulation. These micro-tears can lead to scar tissue, sometimes even early signs of Perion's disease over time. Those tiny injuries harden the tissue, making erections more difficult to achieve and even harder to maintain. That's not just frustrating, it's heartbreaking, especially when you don't know it's happening. There's also something called venous leakage. This occurs when the veins in the penis can no longer trap blood, effectively leading to erections that fade quickly. It's incredibly common in older men, but not inevitable. The truth is, excessive masturbation might be quietly contributing to that process by placing chronic strain on a system that's already under pressure. I want to be clear, I'm not saying masturbation is wrong, far from it, but your body changes with time, and so must your habits. Think of it like an old car. You wouldn't floor the gas pedal every day and expect the engine to last. Same logic applies here. Now here's the part that often surprises my patients. Even if blood flow is perfect, your nerves still play a massive role in pleasure and performance, and the way you stimulate yourself daily might be slowly numbing that connection. Let's talk about that next. If you're still here and this information is resonating with you, go ahead and type the number 1 in the comments to let me know you're tuned in. I appreciate you being here now. Let's continue with the next important point 2. Nerve sensitivity. You might be numbing yourself. One of the most overlooked issues I see in older men isn't just physical, it's sensory. They come into my office and say, "Doc, I can still get hard sometimes, but it just doesn't feel the same." And I get it. I really do. What they're describing is a gradual loss of sensation, a kind of quiet disconnect between the brain and the body, and often without realizing it. Daily, masturbation plays a bigger role in that than most men think. Let me explain this in real terms. The head of the penis is full of sensitive nerve endings designed to respond to light, varied touch. But when a man masturbates the same way every day, same grip, same speed, same pressure, he's essentially training his brain and his body to respond only to that very specific kind of stimulation over time. The nerves adapt, they dull, the pleasure fades little by little, and when intimacy with a partner does happen, it may not feel as intense or worse. It may take far longer to finish or not happen at all. I call this pleasure conditioning, and I've seen it affect hundreds of men, especially those over 60. What once felt natural and pleasurable becomes mechanical and disconnected, and if you're using a very tight grip or frequent fast motions, it only makes things worse. The nerves aren't being destroyed, but they are being overstimulated, and overstimulation leads to desensitization. What makes this even harder to accept is the emotional toll it takes. Some men start to wonder if they've lost something permanently. They feel embarrassed, even ashamed. But this isn't about shame. It's about awareness. Your body is still capable of feeling, but you have to give it a chance to reset. That means slowing down, varying touch, or even taking short breaks from stimulation entirely. Now here's something many men don't expect. Changes in sensation are only part of the picture. Daily ejaculation doesn't just affect your nerves, it can impact your hormones too. And when testosterone drops, everything from desire to energy starts to shift. Let's unpack that next 3 hormonal feedback testosterone can dip. I remember speaking with a patient named Gerald, 72 years old, who came in feeling tired all the time. His energy was low, his mood was flat, and he had almost no interest in sex anymore. He told me, "Doc, I used to feel alive, now I feel like I'm just existing." We ran some tests, and sure enough, his testosterone was significantly lower than it had been a few years prior. What stood out, though, was that he was still masturbating nearly every day, even though his body wasn't responding like it used to. Here's what most men don't realize. While orgasm gives you that temporary release, it's followed by a hormonal drop, a cool-down period where your testosterone can dip, cortisol rises, and the body takes time to recover. For younger men, that bounce back happens quickly, but in your 60s or 70s, your body doesn't reset as easily. When ejaculation happens too frequently without enough recovery, your baseline testosterone may not have a chance to stabilize over time. That can leave you feeling depleted, physically, mentally, and emotionally. Testosterone isn't just about sex drive. It plays a role in muscle strength, motivation, mood, even cognitive clarity. When it's chronically low, everything feels off. Daily masturbation might not be the direct cause of low testosterone, but it can become a contributing factor, especially when combined with age, stress, poor sleep, or medications. It's something many men feel, but never connect the dots on. They just think, "I'm getting older." And yes, aging plays a part. But when you understand the hormonal impact of repeated ejaculation and give your system time to rest and recover, you may start to feel sharper, more energetic, more balanced. I've seen that turnaround firsthand, and it's one of the most empowering changes a man can make. But hormones are only one side of the equation. There's another part of your body that's directly involved every time you ejaculate, and most men don't realize just how hard it's working until problems start to show up. Let's talk about your prostate. If you're still watching and these insights are speaking to you, type the number 1 in the comments, so I know you're still with me. Your time matters, and I'm grateful you're here. Now let's move on to point number 4. 4. Prostate strain. You may be overworking it when most men think about their sexual health. They focus on the penis, but what they often forget is the organ working quietly behind the scenes every single time they climax. The prostate, It's small, about the size of a walnut, but as you get older, that walnut can start to act up, and if you're masturbating daily, you might unknowingly be putting your prostate under more stress than it can comfortably handle. I remember one gentleman, Walter, 68 years old, who came in complaining of frequent nighttime urination and a dull ache between his legs. He was concerned it was something serious. After an exam and some conversation, it turned out he'd been ejaculating almost every day, thinking it was helping his prostate stay active. It's a common myth. While occasional ejaculation can support prostate health, overstimulation, especially at an older age, can lead to irritation, inflammation, and sometimes worsen underlying issues like benign prostatic hyperplasia or BPH. The prostate isn't just along for the ride, it contracts with every ejaculation over time. If it's constantly working without enough rest, it can become inflamed, tender, or swollen. This can lead to a host of issues: urgency, weak flow, discomfort after climax, or even pelvic pain that radiates deep into the lower back. And in some cases, it can mimic or mask early signs of prostatitis or even prostate cancer, which is why it's crucial not to ignore symptoms or assume they're just part of getting older. I want to be very clear here. This isn't about scaring you, it's about informing you. Your prostate is a vital part of your health, and you deserve to know how to protect it. Masturbation isn't bad, but doing it mindlessly every single day without understanding how your aging body responds can take a toll. Now you might be wondering, should I stop masturbating completely? Is it harmful at this age? Or is there a healthy balance? That's exactly what we're going to explore next. And the answer may surprise you. 5. So should you stop masturbating? When men hear me talk about the risks of daily masturbation, especially at an older age, the question almost always comes up. So doc, should I just stop altogether? And I understand where that question comes from. We've spent decades telling men that masturbation is normal, healthy, even protective, and in many ways it still is. But like anything else in life, what once worked for you at 25 doesn't always serve you at 65. The goal isn't to stop entirely. The goal is to become more aware, more intentional, and more respectful of how your body has changed. Masturbation isn't the enemy, but when it becomes a habit rather than a choice, something you do out of boredom, routine, or stress, it starts to carry more risk than reward. Your energy isn't infinite anymore. Your recovery takes longer. Your tissues are more delicate, and your body responds differently. Now, I've told many of my patients this. Think of masturbation like exercise in the right amount, with good technique and timing. It keeps things functioning well, but overtrain and you don't get stronger. You break down. For most older men, cutting back to 2 or 3 times a week can make a noticeable difference in energy sensitivity and even emotional well-being. It's not about deprivation. It's about balance. Also, how you do it matters just as much as how often. If you've been using a tight grip or rushing through the experience, give yourself permission to slow down. Explore gentler, more varied stimulation. Focus on quality over frequency. That one shift alone can help rewire the brain-body connection you may have lost over the years. And if there's a deeper reason behind why you're reaching for release, daily loneliness, stress, anxiety, don't ignore that. You deserve to address those emotions with compassion, not shame. There's more to your health than just the physical still. Even if you adjust your habits, there's one signal your body might be sending that you should never ignore, a warning sign that something more serious may already be developing, and most men don't even recognize it. Let's talk about that next. 6. The one warning sign you can't ignore. There's something I've seen over and over again in my practice. Men waiting too long. They notice something off, but they brush it aside. They think maybe it's just age or it'll fix itself. But there's one sign, one change in your body that I beg every man to take seriously: a noticeable change in the shape, firmness, or size of your penis. I had a patient named Larry. He was 71, active in relatively good health, but over time he noticed his erections were bending slightly, something he'd never experienced before. At first he said nothing. Then came a dull ache during arousal when he finally brought it up. We found early signs of Perron's disease, a buildup of scar tissue in the penis, often caused by repeated microtrauma in his case. Years of frequent forceful masturbation had gradually contributed to that change. This isn't meant to scare you. It's meant to wake you up to something your body may already be trying to tell you. If you've noticed curvature discomfort during erection, a change in girth or length or numbness, don't ignore it. These are not just normal parts of aging. They're red flags that something deeper may be happening, and early intervention makes all the difference. The sooner we act, the more function we can preserve, and in many cases, even restore. And it's not just Perronis. These signs can also point to vascular issues, nerve damage, or early signs of chronic pelvic inflammation. Your penis is like a dashboard light. It may be showing symptoms before your overall health starts to decline. Listen to it. You have every right to feel good, function well, and maintain your sense of intimacy, no matter your age. So what do you do with all this? How do you move forward after hearing so much about blood flow, nerve sensitivity, hormones, and more in our final thoughts? I want to leave you with a clearer picture, a way to take everything we've talked about and use it to protect your health, your confidence, and your future. Let's bring it all together. Final takeaway. If you've made it this far, I want to thank you, not just for listening, but for being willing to have a conversation that many men never allow themselves to have, that says something about you. It tells me you care about your health, your quality of life, and your future, and that matters. Let's take a breath and look back at where we've been. We started with blood flow. How daily masturbation, especially as you age, can place strain on the very vessels your erections depend on. We talked about how repetitive stimulation can dull nerve sensitivity over time, leaving you feeling less pleasure and more frustration. Then we touched on something most men never connect to: sexual health hormones. How frequent ejaculation may contribute to dips in testosterone, making you feel drained, less motivated, and not quite like yourself. We moved on to the prostate, an organ that works harder than you realize too. Much activity can aggravate it, especially later in life, leading to symptoms that can disrupt your comfort and peace of mind. And we asked the question that's probably been sitting in the back of your head: should I stop? And the answer, as we discussed, isn't about stopping. It's about balance, awareness, and treating your body with the respect it deserves at this stage in life. Then came the most important part. The warning sign that one physical change you can't afford to ignore, because the truth is sometimes what seems small is non-see. Your body's way of telling you it needs help, and the earlier you respond, the better the outcome. I've spent over 3 decades sitting with men just like you. Smart, thoughtful, and often carrying more concerns than they let on. What I've learned is this: your health is not a fixed story. It's not too late. You're not too old. You can improve, heal, and even rediscover parts of yourself you thought were gone. But it starts with being honest. It starts with paying attention. And most of all, it starts with giving yourself permission to care. You've done that today, now carry it forward. If this video gave you something to think about, I'd truly appreciate it. If you gave it a thumbs up, a simple like helps this message reach more men who might be silently struggling with the same questions you had. And if you found even one part helpful, consider sharing this with a friend, brother, or someone in your life who could benefit from hearing it. These conversations can change lives, but only if we're brave enough to start them. I also want to hear from you. Leave a comment below and let me know what stood out to you most. Was there something new? You learned something that resonated with your own experience? Your feedback not only helps me make better content, it helps build a stronger, more open community of men who are ready to take control of their health. Thank you for spending your time with me today. Take care of yourself, and don't forget, you're not alone on this journey.